I think precision medicine really is using tools that we have developed to better understand the biology of the tumor and how the tumor behaves, what causes the tumor to form, what may cause the tumor to grow and spread to other areas of the body, for instance. And so by looking at a number of different factors, including the tumor DNA, I would categorize some of the specific histology and histologic subtypes, particularly in lung cancer, as part of that process of precision medicine. But understanding the mutations and the changes in the genes within the tumor itself, as well as understanding some of the changes that occur in each patient when they're born. Sometimes they're more susceptible, for instance, to a cancer. So the hereditary aspects of cancer, again, very important. But that's, in my mind, what precision medicine is. And most of the time, that can be addressed by a biopsy from the tumor, where we get tumor tissue. But increasingly, we're being able to biopsy the blood, meaning get some of the same information just from a tube of blood. We implement precision medicine on every patient at Memorial Sloan Kettering. For instance, as Chief of Thoracic Surgery at Memorial Sloan Kettering, every patient who has lung cancer resected gets their tumor sent away, and the DNA is analyzed, and we get a report back, and it tells us very much about that tumor, so we're in a much better position to make a very personalized, bespoke recommendation for therapy for each patient. Well, surgery is an important part of the care of a lung cancer patient, at least in many cases, although not all. What we're finding is that sometimes after surgery, there still can be a recurrence of the disease. And so we're certainly looking now at better understanding the patient's tumors through precision medicine, and sometimes giving them treatments even before they get surgery, particularly for tumors that are larger or have already spread to the lymph nodes. So certainly the targeted therapies and now immunotherapy, oftentimes combined with chemotherapy, is something that the surgeons are getting used to seeing and operating on those patients after they've had those therapies. It's also important to realize that after surgery, there's going to be sometimes a need for additional treatments that, again, can be personalized based on the precision medicine for that patient. I think the other thing about the precision surgery, if you will, is that we've moved extensively, as have the surgeons here in China, to minimally invasive approaches, either through video-assisted approaches or even robotic approaches. So I think that you'll see more and more of that approach as part of a precision medicine and a precision surgery. And finally, I would say we are beginning to understand the biology of these tumors such that we may not have to do as extensive as an operation if the tumor is not a very aggressive one, and we could remove, for instance, less lung tissue. So these are some of the things that will be coming in the future, things that we're investigating now at Memorial Sloan Kettering about how to personalize the surgery based on precision medicine. Yeah, I think you're absolutely right. You know, one of the things that we do at Memorial, and many places do, is we've realized over the years that it's a team sport. It's multidisciplinary efforts. We all bring something to the care of the patient with lung cancer. And that may be a surgical approach, it may be radiation, it could be medical oncology, radiology, pathology. So the opportunities for collaboration within your own institution, as well as with colleagues around the world, I think you couldn't pick a better time to be a thoracic surgical oncologist with all the great colleagues and all the advances that are going on today. Well, I think the first thing it's going to do is it's going to generate new knowledge through clinical trials, and I think that new knowledge will then be applied to the future patients. And we will know what therapies work and sometimes which ones don't work so well. And we'll be able to, again, better identify which patients really would benefit from this therapy versus that therapy. So I think the other thing is that it will be helpful is it's one of the first times where we're really seeing clinical trials done between the United States and China. Major cancer centers getting together and working collaboratively. And so I think the other advantage, if you will, is it sets perhaps a new paradigm for collaboration. And so I think we're very excited about it.